This is a video teaching you how to foam roll some of your leg muscles. So the purpose behind foam rolling is to improve the muscle's flexibility and then also improve the circulation, decrease lactic acid, and then also reduce any of those muscular knots that can occur, also known as trigger points. And a lot of times, and when people get injured, it's because of overuse, but it's also because you're not allowing your muscles to recover after you did an activity. So if you just recently started running or a new exercise routine and you can tell that your muscles are getting really sore and achy for a few days afterwards, that's usually a good sign that you should start trying to do some kind of foam rolling. And then foam rolls, they come in different sizes, shapes, but it's also the density. So this one, the foam is less densely packed, so it's going to be less intense on your muscles. So I typically recommend something on like this when you're getting started. But then once you've gotten more used to it, this type of foam roll where the foams are more densely packed is going to be more intense. There's also the types of foam rollers that have those knots on them, and that is a lot more intense. So usually that's for more advanced foam rollers. So if you're trying to find different sizes and shapes that work for you, I definitely recommend something that's a little easier on your muscles when you're starting out. But try all these exercises and then let us know if you have any questions. In this video, we're going to do foam rolling through your calf muscle. I'm going to use a longer foam roll just because that's what we have in our clinic right now. You can definitely use the size that is half of this. So this is 36 inches or 3 feet. You can use the 1.5 foot one or the 1 foot one for the calf since it's not that big of a muscle. So we're going to start putting the foam roll down. I'm going to demonstrate on my left calf. So I'm going to straighten my leg, put my calf on the foam roll, and then my opposite foot, the right one, is just going to be down on the ground, and I'm going to have my hands behind me. You're going to start by lifting your hips up, so all my weight is between my right foot and my hands behind me. And then I'm going to start rolling my leg up and down. So right now, I'm just kind of searching around, seeing what type of tenderness, pain, if anything, in the calf. And then you can start to move your foot either in or out to get different parts of your calf. So if I rotate my foot out, I'm going to bias more of the outside part of my calf, and I'm going to go all the way from behind my knee down to my ankle. And so I'm just kind of searching. You might find some tender spots as you keep going, and that's totally good. And then I'm going to flip my foot in, search around in here as well. And so if you get to a spot like I'm on right now where there's a good amount of pain coming, it's most likely a trigger point. And so if you're able to tolerate it, you're going to try to keep the pressure on that spot to try to make it release. In addition, if it's not too bad, you can start to move your foot up and down. And what you're doing here is activating the calf muscles. So you're trying to actively pump out all the lactic acid and other buildup inside that trigger point to release it and then improve the oxygen to the muscle. So you would do this, 1 to 2 minutes until it feels like there's less tender spots everywhere. Now, I showed it with just 1 foot down. If it feels like there's not enough pressure or you've been used to foam rolling for a while, you can take your opposite foot, cross it over the other leg that's down, and then you would lift yourself up using just your hands and do the same thing here. So this increases the pressure that's going into the calf muscle, but it's a lot of upper body and core work. So you might not be able to lift yourself and do that motion, which is totally fine too. You can just stick to the version that we did first. So again, you would do this about 1 to 2 minutes. You can do it about 4 times a week, or especially after increased activity. So this is going to be a video for foam rolling for your hamstring muscle. The hamstring muscle is on the back of the thigh, and it goes from behind the knee all the way to your hip. And so if you watch the calf foam rolling video, it's gonna look very similar. I'm gonna use the shorter foam roll for this just for demonstration purposes, but you can also use the longer one, or if you have one that has spikes or bumps into it. So I'm gonna place the foam roll behind my thigh, and then one leg's gonna be out relatively straight, and the other one's gonna be bent. And then using my hands, I'm gonna lift my hips up, and then I'm just gonna start rolling down my back of my thigh, using my right leg kind of as a fulcrum to help me move. And then similar to the calf, I'm gonna try to get all the different parts of my hamstring muscles. So if your foot is straight, you're doing right in the middle, but then you also wanna rotate your foot out to get the outside part of your hamstring. And then you're searching for any tight, tender spots that might feel knotted or uncomfortable. Once you get to a tender spot, it might start sending pain to different parts of your leg, or just might be really tender right there. So if you're able to stay on that spot for a little while until it starts to relax, that is gonna be better for at least releasing those tight knots. And then you're also gonna rotate your foot in to get the inside part of your hamstring. And then similar to the calf, once you get to one of those tight spots, you're gonna, if you're able to, try to gently bend and straighten your knee. And that's gonna be actively activating the hamstring muscle and trying to pump out that trigger point a little bit quicker. So you're gonna do this for about 1 to 2 minutes and about 4 times a week if you're able to. So this is a video for foam rolling your quad. Your quad is the muscle on the front of your thigh, and it goes from your knee all the way to the front of your hip. And so for foam rolling this muscle, it's a little awkward because you basically have to be lying on your stomach on top of the foam roller. So I'm going to basically go into a push-up position and try to place this foam roller on the front of my thigh. So my arms are out in front of me, and then I kind of have both toes pressing back. And then the foam roller is under my left leg, and my right leg is just kind of out here without anything underneath it. And so using my arms and both toes, I'm gonna start rocking my body forward and back. Again, kind of searching for those tight, tender spots. And then I'm gonna start rotating my leg out. So if I rotate it a little bit out, I'm kind of on like a side position almost, I can get the outside part of my quad. And then if I rotate my body the opposite way, I can get the inside part of my quad. Again, looking for those tight, tender knots and trying to add pressure if you can. So I demonstrate it with one leg out straight to increase the pressure. You can also cross your opposite foot over the leg on the foam roller and then do the same thing. I am keeping my toes still on the ground of the bottom leg, but my top foot is just kind of hanging out. Trying to search for those tight, tender knots. And again, I'm doing this about 1 to 2 minutes at a time, and then about 3 to 4 times a week. So this video is foam rolling for the IT band. So the IT band is not actually a muscle, it's a piece of fascia, which is also connective tissue, and it runs from the outside part of your knee, up the side of your thigh, and into your hip, and it's a continuation of a muscle called TFL, which is also a hip flexor. So can't really foam roll the IT band, but for simplicity, we're gonna call it that. But really, where the IT band is going, the quad muscle, the outside part of your quad is underneath that muscle. So that part can get really tight and knotted up as well. So on the last video we just did, it was foam rolling for the quad. And so when you rolled the outside part of your thigh. If that was really tender, then this next video is gonna be probably very beneficial for you. So we're gonna take the foam roller and then you're gonna turn on your side, and the bottom leg is gonna be almost completely straight. And then the back leg, so my right leg in this video, I'm gonna move it in front and keep my foot flat on the ground and then have both hands here. And so with my leg and then my two hands, that's gonna be what's controlling the motion. And so you're just gonna start rolling down, kind of finding some tender spots all the way from the knee up to the hip. And so again, kind of finding some tender spots, holding it, trying to release that knot. If you want more pressure, you definitely can begin to like bend that bottom knee and straighten it a little bit. So I'm kind of like making like a little arc motion on the ground, but again, this is very tender area of the muscle, so might be just enough just to kind of keep some pressure on there. And so similar to the other videos, then to get different parts of that lateral quad muscle, you can kind of roll forward a little bit and get the same type of response there, or you can roll backwards a little and get that muscle. So again, you're gonna do this about 1 to 2 minutes. You can do it a few times a week, but especially after activity would be the most beneficial. This video is gonna be for foam rolling the piriformis and the glute muscles. So the glute muscles are basically your butt, so the back of your hip, and they run from your hip bone all along your pelvis to your tailbone. And there's 3 different glute muscles. And then the piriformis muscle is deeper, and it goes from your hip bone to your tailbone, kind of making an oblique line. So foam rolling for these muscles can be very beneficial, especially if you sit most of the day at work, and those muscles can get all knotted up and achy. And so this will be a good technique for trying to release some of those muscles. So I'm gonna take my foam roller. If I am trying to massage my right hip, first I'm just gonna sit on the foam roller, and this version is gonna be a little less intense. And then, keeping both feet on the ground, I'm just gonna shift my hips over, so my knees are going to the right, and I'm kind of sitting more on the side of this foam roller. So, different angle, sitting on it, and then I'm just shifting over to kind of get right underneath that hip. And then I'm just gonna start rolling back and forth, trying to find some tender spots. Once I get there, just kind of hanging out in that position. You can try to get different parts of the glute, kind of going different angles. You can turn a little bit more on your side as well. So this version, like I said, is a little less intense. The next version I'm going to show is if you want a little bit more pressure. So if you've ever stretched the piriformis muscle on your back with your leg kind of up and you're pulling down, this is going to look pretty similar to that. So I'm going to sit on the foam roller. I'm going to put my right heel on my left knee, and then making like a figure 4 with my legs. And then I'm gonna do that same thing where I shift my hips over, and then I just kind of use my hand on my knee for support, and then I foam roll this way to show you different angle. Again, I'm gonna sit on it, right heel on left knee, shift my weight over, and then foam rolling back and forth. So I'm just using my right hand and my left foot kind of as my fulcrums, massaging back and forth, getting to a tender spot, and then trying to hold for a few seconds. But you can do this for 1 to 2 minutes, and then a couple of times a week.